Testosterone replacement therapy promises to boost our energy, build up our muscle, and improve our sexual function. But could it come with some hidden risks? If you're on TRT or thinking about starting, you'll definitely want to hear this. In this video, we'll explore whether or not testosterone replacement therapy can increase the risk of heart problems like chest pain, palpitations, and related anxiety. We'll dive into my own clinical experience and explore some potential theories behind why these symptoms may be more prevalent in one person versus another. And we'll review the latest research to address these concerns. My name is Dr. Terranella, and this channel is all about helping you optimize and improve your health. We'll draw on my 15 plus years of clinical practice and also some scientific research. If you're liking these videos and getting a lot out of these videos, be sure to hit the like and subscribe button to continue getting videos like this one. All right, let's look at how TRT could affect your heart. So over the years, I've seen quite a few patients on testosterone replacement therapy, and I've definitely come across my fair share of those that were on TRT and had some cardiac complications. And it's hard to know if the other provider recognized that the testosterone could have been the cause for those cardiac complications, or if they just didn't look into it deep enough to really understand. So what I want to do in this video is help you better understand what some of those cardiac complications might be, how it might feel if you're experiencing those, and most importantly, why they might be happening, and then what we can do to resolve those issues that you're having. So first, what we're going to do is draw out kind of the overall clinical picture of someone that tends to come in with this problem. Like how quickly does it come on? What are the ranges of testosterone that might be going on in some of these cases? And then we'll move into some of the theories about why this is happening and also what the research suggests about it. So what are some of those symptoms, or how might someone feel if they're experiencing some of these heart issues from testosterone replacement therapy? Well, what I've seen is increase in heart palpitations, like feeling your heart beating in your chest, and also sometimes feelings of like a butterfly in the chest or something like that, where the heart actually like skips a beat. Sometimes shortness of breath, sometimes it's thought to be related to anxiety, and sometimes it could be presenting like chest pressure, which makes people think they're having a heart attack. And for sure, if you're feeling that, you definitely want to get that checked out by a cardiologist right away. And that's oftentimes, in my experience, they've already seen a cardiologist once or twice, maybe once in the ER, and then they get referred for a workup to see if something's going on with their heart. 9 times out of 10, there's not anything specific that can be found or linked to anything organic. And so if you have this going on, you start to think, well, maybe you're anxious and just worried about something. And that's more than likely not the case. So when does this typically come on in someone that's on testosterone? Well, that's where some of the confusion comes in, because the symptoms of chest pressure, pain, discomfort, and things like that don't always come on within the first few weeks or even first few months that you're on the testosterone, which means there's a significant delay in when you're going to start noticing these symptoms in relationship to when you started the testosterone. As a result, you kind of start to think it's not the testosterone. So then you see specialists and try and understand what's going on. And you remember that you really thought the testosterone was really helping you when you first started it, so you really don't want to stop it. And it's at this point where basically what I tell people is, okay, time out. Why don't we look at your labs and see what I see in your lab results? Maybe your testosterone's a little bit higher than it should be. Maybe your estrogen's a little too high. Maybe your cortisol's high. Well, let's just look and see what's going on. Okay. And sure enough, in most cases, what we see is that the testosterone's a little bit high. Maybe the estrogen is normal. Maybe the hematocrit's a little bit high, but for sure, in most of the cases that I've seen, actually all the cases that I've seen, they had testosterone levels that were higher than the actual lab reference range. And that doesn't mean everyone that's outside of the reference range is going to have this problem. And that's what I always try and emphasize, is the amount that you need is not necessarily the amount that someone else needs. You could be the same age, have the, exact same lifestyle, and still you may need a little bit less than the next person, or you may need a little bit more than the next person. So 9 times out of 10, when we start to get those labs back and start making adjustments in their testosterone dosing, or sometimes adjusting their estrogen, or just having them go donate blood if their hematocrit's really high, most of the time you're going to get some relief from some or all control those. But what I've seen is that when you reduce the testosterone levels in patients that are having these heart palpitations and chest pressure, just by reducing the dose, you're going to get some significant improvement in some of those occurrences. And usually it'll just go away completely. Now we have to think, why would that be? Why is this person not able to take the maximum amount of testosterone for his age, demographics, etc.? And this person is, blowing it off the chart and doesn't have those symptoms at all. Well, for sure, there's probably some genetic things going on with each person that create some of this. There could be some different quantities of receptors in the heart tissue that make it respond more to certain chemicals that our bodies produce, such as testosterone and other stimulating substances like cortisol, etc. And for sure, testosterone does stimulate the sympathetic nervous system and tends to increase the overall adrenergic tone in the body. Adrenergic is the fight or flight type of chemicals that are in our bodies. They're good when we don't have enough. We want to raise those. But if we raise them too much, then we become anxious and have problems, maybe palpitations and things like that. We don't have enough. We may be more tired, more depressed, things like that. So that's my model for working with testosterone, and especially in those that have anxiety or tend to have heart palpitations and issues like that, is we don't want to overdo it in those instances. In some cases too, it certainly could be the estradiol levels going up higher than they should be. Again, each person can be slightly different that way. And estradiol for sure is going to increase sodium absorption in water, and you can get some swelling and pressure for those reasons too. Hematocrit is also something that is going to increase the overall volume and possibly blood pressure in someone with this kind of thing going on. And sometimes independent of the hematocrit, you'll have high blood pressure. And so a lot of times people do come in taking a beta blocker and or some kind of thing to lower blood pressure, sometimes one, sometimes both. And that makes sense in the presence of, okay, this person has high blood pressure, but what happens when we reduce the dose? Do those palpitations go away? And then maybe we don't need that blood pressure medication. So that was my theory going into it. And then I wanted to go to the research to see if I could find some evidence to support these theories. And so what do you know? There's a recent study published in The Lancet that looked at a group of men. They just basically looked at their testosterone values, and those that were in the upper third of the bell curve or on the higher end of the bell curve had a twofold increase in atrial fibrillation. And atrial fibrillation is basically when you have some cells in the heart tissue in the top part of the heart called the atrium that are firing at a rate that is incongruent with the natural rhythm of the heart. So it'll basically fire a signal when you have the natural heartbeat going. It'll fire a random one in there, and it'll cause the skipping or sometimes faster beat. And it does it in an irregular way. So adrenergic stimulation to the heart tissue or the nervous system tissue is definitely going to speed up those cells, those maybe quiescent or dormant cells that otherwise, when they get stimulated, are going to start to fire off. And they're not going to do it right away. It's going to take time for that to build up. And so indeed, that may be what we're seeing in cases where people are having palpitations and feeling chest pressure and things like that. And in the Traverse trial as well, one of the hallmark newer studies on testosterone replacement therapy and showing basically how much benefit there is in most cases for supporting cardiovascular health. They also did find that there is an increased risk of atrial fibrillation in the men that were on testosterone replacement therapy. And so this just supports the idea that there's increased activity in the heart, which could for sure be coming from that sympathetic or adrenergic activity. And we know that people with high blood pressure often get put on beta blockers. And beta blocker is basically a beta adrenergic receptor in the heart tissue. And so it makes sense that testosterone is increasing the adrenergic activity, and oftentimes you get put on a beta adrenergic blocker. And there is definitely some evidence that testosterone replacement therapy, when you stimulate tissues in vitro with testosterone, the beta adrenergic activity definitely goes up. Putting two and two together, plus the research, definitely suggests that there's some kind of increased sympathetic drive going on in people that are getting these side effects on testosterone replacement therapy. So if this is happening to you, here's what you need to do. First of all, you want to look at where your testosterone levels lie, as well as your estrogen and hematocrit on your blood tests within the last couple weeks. You also want to make sure when you go in for that blood test that you're going at the somewhat peak of the testosterone levels. So that means if you inject it today, you're going to go test 3 to 5 days after you've injected. Not 8 days after, not 6 days after, not 7 days after. 3 to 5 days, that's when you're going to capture the peak of when the higher levels are in your body. We want to know just how high those are. And if you're someone that's a little bit older, say maybe 65 and up, your heart tissues, your nervous system is definitely in a more fragile state. So stimulating those cells can definitely be a little bit more common as you get older. So that's why we want to shift the range just slightly as you get older. And of course, the reference range does go down as you get older as well. The other thing is if you already have cardiovascular disease, then you're going to want to take that into account as well. There's no absolute number that you should be targeting for where you're at right now, but once you get that number and what it is, that's when you're going to make the shift. If you're having these symptoms, we need to lower the dose. Now, if you're going to be changing what you're doing on your prescription, you need to bring that to the attention of your prescriber. They may not agree. They may have a different plan. So that's a conversation you have to have with your prescriber. In my opinion, what I do with my patients is we're going to lower the dose, maybe by like 10%, maybe even more, depending on how severe the symptoms are. And also where you're at demographically in terms of, am I older and do I already have some heart issues that I want to be extra cautious about? That may speed up, and you can always tweak the dose back up and play with this as you go. But again, make sure you're bringing your prescriber in the loop. So you're going to be on this new dose for a period of 4 weeks, 6 weeks, and then you're going to retest. Now you may be feeling better. It's not going to happen the first week. It's going to take a while for that testosterone level to kind of come down out of all of your tissues. The blood levels will change quite quickly, but what's happening inside your tissues is going to take a couple weeks for everything to kind of level out. This is probably a good time to just step back and say, if you are having these cardiac issues, feeling chest pain and things like that, you definitely need to bring it to the attention of your provider. You don't want to ignore cardiac symptoms just because you think it's from testosterone. So it's important to stay safe and stay diligent with that kind of thing as well. So you want to get a cardiac workup. You definitely want to get some kind of EKG to verify that you're not in atrial fibrillation or something more severe. Okay, so we want to make sure we're monitoring. We want to make sure we're in the optimal range time when your testosterone levels are going to be high on the first reading and the second reading. And basically moving forward, you want to be monitoring in that peak range. We also want to stay on top of hematocrit levels, blood pressure, estrogen, and it's also a good time too to kind of reevaluate your whole health and make sure nothing has been overlooked in terms of vitamin levels. Sometimes low iron, if you're donating blood a lot, can also cause similar types of issues. And it probably goes without saying, but yeah, you need to have a full cardiac workup to make sure there's nothing going on that needs to be treated more aggressively. So we covered a lot of ground in this video on specifics about testosterone and its link with heart problems, but there's a lot of things that we didn't cover in this video, and you may find it useful to look in my playlist for more detailed information on specific topics that may be of interest to you. Hopefully this video was helpful in helping you understand the intricacies of testosterone replacement therapy in heart symptoms and cardiovascular problems. If you have any questions, please drop them in the comment section. I'm happy to answer your question. If you want a more detailed and customized answer to your question, consider joining the membership program where I'll have more time and attention to dedicate to your question. Now, one question you might have after watching this video is, what are the risks of heart attacks and strokes from being on testosterone replacement therapy? Is there a link there? You can find those details in this video right here.